Hi, I'm Dave Gustafson, Senior Ops Director with Access Airway, and I'm here with Rob to share his story with a difficult intimation. Thanks for taking the time today, Rob. Appreciate you joining me to talk a little bit about your experience. Want to introduce yourself quick?
Sure. Yeah. My name is Rob. I am an attorney here in town, and I started having some symptoms about 18 months ago, where my hands started tingling. I thought really nothing of it, but the symptoms started to progress to the point where I started experiencing weakness in my hands. And also loss of hand-eye coordination with my fingers. And as the time went on and the symptoms worsened, I decided to go and talk to a neurosurgeon who, after testing, indicated that I had significant herniation between my three vertebrae in my neck, and suggested that I needed to, have some sort of procedure to alleviate the symptoms, that the nerves that were misaligned and not communicate with my muscles and what have you. And so I agreed to do that. He assured me that the procedure, which amounted to a cervical spine fusion, would immediately alleviate kind of the symptoms.
Excellent. And how did the surgery go, and how has the recovery been since you had surgery?
So the surgery, I went under, and when I woke up, I immediately noticed that there were no symptoms anymore. The issues that I was having with the tingling, and even in some cases the weakness of the grip and what have you, were gone. And when my surgeon and his team came in and talked to me, they said that the surgery went really, really well, but for one thing, and that was when they told me that they had a very, very difficult time intubating me. It was the first time I ever had any surgical procedure, and what they told me was that I had a abnormally narrow air passage. So it took a very, very long time to intubate me. And because it took a little bit of a long time to intubate me, they indicated there could be some issues, with my throat and with my swallowing and what have you, that, would be a little bit more significant than somebody who they did not have as hard of a time intubating.
Got it. And did you have any indication beforehand that the intubation might be difficult, or is that something you or the physicians have been able to prep for?
No, there was no way of knowing because I'd never had surgery before. And the surgeon even said, in the future, you should tell anybody who's going to be performing surgery on you about this issue, because it was difficult, and it could be difficult for future procedures.
Got it. And what have been some of the ongoing impacts of that difficult airway?
Yeah, so my voice is not recovered 100%. I mean, my vocal cords are fine, but they've been weakened, and they're going to require me to go through some physical therapy to kind of retrain my voice to get back to kind of my normal voice. I'm also having sometimes difficulty swallowing. Things get lodged down there in my throat, and that is due to what my understanding is kind of my muscles not being weakened because of the surgery and not being trained to help the food or whatever go down the correct airway. And then in some cases, sometimes I'll have something down my esophagus go into the wrong airway, which forces me to cough things up. Surgeon said that, or the doctor said that it shouldn't be an issue, but it's going to require physical therapy to kind of strengthen those muscles.
Yeah, really sorry to hear that. That sounds tough. What led you to reach out to us at Access Airways?
Well, I mean, somebody had mentioned, your technology, and basically what you are, what you're developing is to really address situations like my situation, where, possibly, using this sort of device to make it easier to intubate may not result in some of the post, surgical conditions that I'm experiencing with my throat, with my voice, with my airways. And so, I just reached out to kind of learn more about it and know about it, so that in the future, if I need to go, have surgery again, I can certainly kind of notify my surgeon about it, and maybe talk a little bit about options, including, your device.
It's awesome. Well, thank you so much Rob for sharing today. I appreciate your time and wish you well in your recovery. Thank you so much.
All right, thanks so much.